I'm going to tell you about the kind of key features of anorexia nervosa. Actually, what I'm going to tell you are the 4 diagnostic criteria that are currently in the diagnostic manual used by the majority of mental health providers in the United States and used by psychiatrists. That's the manual called the DSM-4. And so the diagnostic criteria for anorexia nervosa is first a refusal, or maybe a better word is really sort of an inability to maintain body weight at a minimally medically appropriate place for one's age and height. And the DSM suggests that that minimal medical criteria be around 85% of ideal body weight. So that's criteria number 1, and there's really sort of a relentlessness to a person's drive to maintain this thin place that is so characteristic or core to anorexia nervosa. Number 2 feature is intense fear of gaining weight, even though underweight. Number 3 is a disturbance in the ways one's body's shape or weight is experienced. It could also be a denial of the seriousness of the underweight condition. Oh, there's nothing wrong with this, there's no medical compromise, that type of thing. The 4th cardinal feature of anorexia nervosa, which is currently a diagnostic criteria, is that the starvation state has gone on long enough and has become serious enough that the body is starting to shut down, and how this is manifested in women is by the absence of menstrual cycles. So if you see, due to underweight, the absence of 3 or more consecutive menstrual cycles, that is called amenorrhea, and that's currently another diagnostic criteria of anorexia nervosa. In fact, as professionals, even though this is on the list of diagnostic criteria for anorexia nervosa, we often see folks that meet all the other sort of core features of anorexia nervosa, but don't have the absence of menstrual cycles for whatever reason. Maybe their body just hasn't quite shut down yet. Or maybe they're on birth control pills and they're still getting their period, even though the body is in general in a very starved state. We also see male patients with anorexia nervosa. While they're the minority of folks suffering from anorexia nervosa, males do also get this illness. And obviously males can't lose their menstrual cycle, but there are men out there that meet all these other core criteria of the illness, and we would call those men as having anorexia nervosa. So those are some of the core features. There are lots of other signs and symptoms that go along with anorexia nervosa. There can be a lot of medical consequence, and if I haven't emphasized this until now, anorexia nervosa in particular can get quite severe. It really has a high morbidity and even mortality rate. It's got amongst the highest mortality rate amongst all the psychiatric illnesses, with a mortality rate of 5% per decade of untreated anorexia nervosa, or unremitted anorexia nervosa, I should say. And people can become quite medically ill and even die from things like cardiac causes, from electrolyte imbalances, as well as from psychological complications of the illness like severe depression and suicidal urges and tendencies. So a lot of other things that you can see with anorexia nervosa. There's a lot of ritual that goes into the eating associated with anorexia nervosa. People that cut up their food into lots of little bites, strict regimens of calories, perhaps on the order of 500 to 700 calories a day, or maybe even less, is characteristic of this illness. And you can also see binge eating and purging behavior going on in anorexia nervosa as well. So a lot of different things that can be present in this illness, and very complicated to treat. Definitely someone that's struggling with this, if you're struggling with it, reaching out to an expert in this area, a treatment center that has experience with anorexia nervosa, is essential for moving through the anorexia nervosa and into the process of recovery.